Healthcare systems continue to track patients who have survived COVID and study the after effects on their health in many ways. Joining us to talk about the impact being studied on the heart is Dr. Anish Tolat, cardio-electrophysiologist and director of VT ablation at Hartford Healthcare Heart and Vascular Institute. Doctor, welcome.
Thank you. Thanks for having me.
Thank you for being here. So researchers are now looking at autopsy results of COVID patients. Tell us what they're finding.
Yeah, so we've been learning more and more about the virus over the last few months. And there was a recent study out of Germany where patients who died of the COVID virus, mostly from lung-related complications, had actually autopsies performed on their hearts. And when they looked at the hearts, about 61% of patients actually had some form of involvement that they attributed to the COVID virus. And so they were also able to actually show that they were able to show traces of the virus from within those autopsied hearts as well.
All right, talk now about what the study showed regarding the hearts of patients who recovered from COVID.
So this was a separate study, again, out of Germany. We're learning a lot from the Germans. They actually looked at patients with mild and moderate symptoms who recovered from the virus. And what they found were that patients who had MRI scans performed after their recovery had a fair amount of involvement. About 78% of patients had some form of involvement in their heart despite recovering from the virus. And more striking was the fact that they found that 60% of those patients had evidence for ongoing inflammation within the heart.
All right. How can this information help in the treatment of COVID as we move forward?
So, I think the first thing that we always stress and emphasize is that prevention is the best treatment. And so as we move into the fall, we want to make sure that we're keeping safe. But with regard to this data, I think that we want to make sure that if patients are recovered, that we keep an eye on their heart as well. And sometimes we don't always think about that, but we want to make sure that their heart is safe and healthy.
All right, what if patients get into heart trouble after recovering from COVID? What options do you have available at Hartford Healthcare?
So at Hartford Healthcare, as many of you know, we do have a fairly robust program from everything from cholesterol to heart transplant. So with COVID patients, they may develop problems with their rhythm later on. They may develop even weakening of the heart. And, I'm proud to say that we have everything to take care of you here, including, if you need it, a left ventricular assist device, a pump, or even a transplant. So we're ready for whatever comes our way.
All right, Dr. Anish Tolat, thank you very much for being with us.